July 4th.
In the effort to increase COVID-19 vaccine distribution, the Biden administration hopes to vaccinate millions of 12 to 15-year-olds soon.
That's right. The FDA could authorize it as soon as this week. Elise Haas spoke with a doctor who is monitoring the vaccine trials. Elise joins us live with more.
Jenny and Ken, parents who are fully vaccinated obviously still have their kids to worry about. They were telling me that it's not as enjoyable to go on a family vacation to see grandma and grandpa if there's still that risk involved. And so one of those parents that I talked to is a doctor here at OHSU. He's also the Associate Chief Medical Officer of Capacity. And Dr. Merkel says that he's watching the developments with the vaccine trials for teens very closely, and he is hopeful that his household will soon be able to enjoy the protection from the vaccine.
I have 3 children, 2 of them are under 16, and I'm waiting for them to be eligible to get vaccinated because I think it's the best risk reduction we can offer any of us to not ending up in any of our ICUs needing this therapy. And it reduces substantially your risk of dying of COVID-19. So yes, absolutely, get vaccinated.
Having a safe vaccine for 12 to 16-year-olds also significantly increases Oregon and America's chances of getting closer to community immunity. And again, that number sits around 75% of people needing to be vaccinated to suppress COVID from routinely spreading. Without it, it would have required nearly all of adults to get their shot, and that didn't seem like that was going to even be close to possible. To be clear, at this point, from that benchmark right now, Oregon's still updating their data as of this morning, but at last checked, it was hovering around 30%, maybe a little bit more. And then that's keeping pace with the United States, which has that 32%. So when I talked to the Oregon Health Authority, Ken and Jenny, they were telling me that even if we don't reach community immunity, which would be really tough to do, what it would still do is it would reduce severe disease, it would reduce hospitalizations, and ultimately it would reduce deaths. And that's something that Dr. Merkel says is going to be the key to our path forward. Reporting live, Elise Haas, Queen 6 News.
Thank you, Elise. Meanwhile, students at Portland State